Hi everyone. Today I am going to discuss a past paper of pediatric nursing module. Uh, the paper I am going to discuss is uh, January semester 2018 paper. So I'm not going to discuss all 40 questions, but I will discuss only 20 questions since we have very limited time. Uh, we Now we see what's the first question. Um, the first question is during examination of a newborn baby, a nurse found baby's skin is slightly dusky, pale and blotchy. Which of the following condition describes the above statement? Answer A. Acrocyanosis, B. Mottling, C. Petechiae, D. Palo. So what is the correct answer? Acrocyanosis is a condition marked by bluish or purple coloring of hands and feet caused by slow circulation. Mottling is the blotchy and red purplish marking of the skin, and it can be due to poor circulation or congenital heart problem or exposure to cold environment. Because of these things, mottling can happen. Petechiae is pinpoint round of spots that appear on skin as a result of bleeding. Palo, it's the pale appearance. So what's the correct answer? So correct answer is answer B, mottling. In mottling you can see dusky, pale and blotchy skin. Now we'll go to the second question. The question is which of the following injection sites would a nurse select to administer vitamin K to a newborn baby? So you know that vitamin K is administered through intramuscular route. So usually we select the lower limb for infants because in infants we have to select a good muscle, so we use the lower limb. Usually when we give IM injection, we use lateral aspect of the muscle, not the medial aspects, because all the nerves, major blood vessels are going through the medial aspect. So usually when we give IM injection, we divide the muscle into three, and usually we use the middle third of the muscle. So which muscle actually, which muscle we have to use? Vastus lateralis is located on the side of the thigh, that means the lateral aspect, and rectus femoris is attached to the hip and helps to extend the raise help to extend or raise the knee. So it is situated medial to this vastus lateralis muscle. And gluteal muscles, the muscles which make up buttocks. So the best site is, since vastus lateralis muscle is in the lateral aspect of the lower limb, it's the better muscle, and so lateral aspect of the middle third of the vastus lateralis muscle is the most suitable side. So answer is answer A for the second question. Then we'll move on to the third question. Question is, a nurse caring for an infant with bronchiolitis assessing for signs of dehydration. Which of the following is the most reliable method determining fluid loss? So you know that all these using all these signs things we can have some kind of idea about the dehydration of the infant. Um, Using intake, output, fontanelles, mucous membranes and weight. But the most significant, most reliable method is intake and output, because we can correctly say what's the amount of what type of dehydration is there, whether it is mild, moderate or severe, because we know the intake versus output. But using fontanelles and mucous membranes and weight, we can get only rough idea about dehydration. So the most reliable method is intake and output. Then fourth question. During the pediatric behavioral assessment, a nurse noted that an infant's eyes are open when drowsy, aroused easily by stimuli, and irregular breathing. What type of behavioral assessment used to obtain the above findings? So, you know that there are several tools that we can use to assess neonatal behavioral responses. So one tool is neonatal perception inventory. The second is Brazilian neonatal assessment scale. So in neonatal perception inventory and Brazilian neonatal assessment score, those two we can use to assess behaviors of the infants. But new blood score we use to assess the gestational age, and using neuromuscular maturity we cannot assess the behavior of the infant. So answer C and D we can ignore. So among answer A and B, what is the best answer? So neonatal perception inventory we use to assess maternal perception of certain neonatal behaviors, and it may predict behavior interaction between mother and newborn. So, and this Brazilian neonatal assessment scale be used to identify 6 stages along a continuum from deep sleep to active and alert. So it has explained the characteristics of these stages. So the answer is Brazilian neonatal assessment scale, that is answer B. Now we'll move on to the fifth question. Question is, a 2-year-old child is hospitalized because of severe diarrhea and vomiting. Why should the nurse monitor the child closely? So when there is severe diarrhea and vomiting, there will be dehydration. So this dehydration can cause serious complications like shock. My answer is to detect dehydration, answer A. But in this OUM has given the answer as to detect metabolic alkalosis. So when there is diarrhea and vomiting, severe fluid loss, there will be a metabolic alkalosis also. So it also can cause serious complications, I think. But the better answer is to detect dehydration. So my answer is answer A, but they have given answer as C, so there is a confusion. So according to my knowledge, the better answer should be answer A, to detect dehydration. Then question number 6. Question is, a 4-day-old newborn baby receiving phototherapy for a bilirubin level of 260 millimoles. What is the specific nursing care for that baby nursed under phototherapy? So, having minimal contact with baby to continue phototherapy. That's the first answer, answer A. So actually, when mother needs to feed the baby, mother has to take the baby and she needs to feed. So we cannot maintain minimal contact because there is a need for feeding for the baby. So, and second answer is advise mother to limit oral intake during phototherapy. No, it's also wrong, because when there is a phototherapy, there is a dehydration risk of the baby. So frequently we have to feed the baby. Then answer C, apply lotion to prevent irritation to newborn's skin. It's also wrong, because applying lotions and creams are not recommended when there is phototherapy, when the baby is under phototherapy. And answer D, assessing skin integrity, fluids and electrolyte of newborn baby. Yes, answer is D. You have to assess skin integrity, fluids and electrolyte of newborn baby, because there is a risk of dehydration and breakdown of skin due to the dehydration and due to heat. So you have to assess the skin integrity, fluids and electrolyte of newborn baby. So the answer is answer D. Now move on to the 7th question. Question is, a nurse caring for a 2-year-old child diagnosed with bronchiolitis. What are the signs of impending hypoxemia and respiratory failure? So when there is hypoxemia and respiratory failure, so what are we see the answers. Cyanosed, you know what is cyanosis? Marked subcostal recession. Subcostal recession means syndrome of parts of the chest due to negative pressure, negative intrathoracic pressure. And stridor is high pitched wheezing sound caused by disrupted airflow. So this stridor can be caused by blockage in the larynx or trachea, and or tachycardia may be there. So The signs of impending hypoxemia and respiratory failure include cyanosis, a marked subcostal recession, and feeding difficulty. And cough will not be there, and the subcostal recession will be severe, not mild. So the best answer is answer A, cyanosis, marked subcostal recession, and feeding difficulty. Now we'll move on to the 8th question. Question is, a nurse is monitoring for signs of dehydration in a 1-year-old child who has been hospitalized for severe diarrhea. What are the signs of impending shock in severe dehydration? So all these signs and symptoms in the answers are signs of dehydration, but the poor urine output, decreased blood pressure, poor urine output, dry mucous membrane, poor skin turgor, these occurs at the beginning of the dehydration, but when it comes to the end, or when it becomes severe, so the pulse rate will goes up, respiration goes up, the blood pressure will drops. So the answer is increased pulse and respiration, decreased blood pressure, and prolonged capillary refilling time. So answer is answer is C, increased pulse and respiration, decreased blood pressure, and prolonged capillary refill time. Now the 9th question. Which of the following is the signs of severity for childhood asthma? Asthma, we can, according to the severity, we can categorize into 3 categories, like mild, moderate, and severe. So the strong wheezing, difficult speech, and strong expiratory breathlessness are signs of severe asthma. And marked wheezing, restricted speech, and respiratory breathlessness are the signs of moderate asthma. Agitation, increased pulse rate are the signs of mild asthma, and marked respiratory breathlessness is a sign of moderate asthma. And marked accessory muscle, marked wheezing, and increased pulse rate are the signs of moderate asthma. So the question asks about the severe asthma. So answer is answer A, strong wheezing, difficulty speech, and strong expiratory breathlessness. Now move on to the 10th question. Which are the clinical manifestations for severe acute respiratory syndrome, or SARS, after day 7 of the illness? So at the beginning, the signs will be fever more than 38 Celsius, headache, fatigue, malaise, anorexia, diarrhea. All these are signs of SARS at the beginning, but after 7 days, most of the patients develop pneumonia. So after 7 days of illness, the patient will develop nasal flaring, pallor, and clubbing of fingers, which are the signs of pneumonia. So the answer is answer B, nasal flaring, pallor, and clubbing of fingers. Now move on to the 11th question. So question is, a nurse is performing an assessment on a 4-month-old infant with hydrocephalus. What is the prominent assessment required for this infant? So how you can identify hydrocephalus? So hydrocephalus is fluid collection in the brain. So first sign of hydrocephalus will be bulging fontanelles without head end enlargement. So if you palpate the anterior fontanelle, it will be tense, bulge in a non-pulsatile, and with the increase in intracranial volume, the bones of the skull become thin and the sutures become palpably separated to produce the cracked pot sign on percussion, and eyes will be rotated downward. There will be sluggish pupils, poor feeding and frequent vomiting, changes of level of consciousness when there is hydrocephalus. So how you can diagnose, so how you can identify the hydrocephalus? So what you have to do is you have to palpate the anterior fontanelle. So answer is C for the 11th question. Then question number 12. What is the appropriate position for infant who just had a ventriculoperitoneal shunt? So you know that we put a VP shunt to drain the fluid inside the brain to the peritoneum. So if we just after the operation, we have to keep the patient in a position which facilitate this drainage. So what's the best position we have to keep the patient is we have to elevate the head of the bed to 15 to 30 degrees to enhance gravity through shunt. So answer is answer C. Then question number 13. Which of the following categories considered as high level of anorectal malformation? So when we take anorectal malformation, these anorectal malformations can be classified into 3 levels as low, intermediate and high. These malformations may vary depending on the sex. Low-level malformation in females include anovestibular fistula, anocutaneous fistula, anal stenosis, and rare malformations. In males, it includes anocutaneous fistula and stenosis. Intermediate malformation includes rectovestibular fistula, rectovaginal fistula and agenesis without fistula if it is a female. In males, intermediate malformation include rectobulbar urethral fistula and agenesis without fistula. And high malformations include anorectal agenesis and rectovaginal fistula or anorectal agenesis without fistula and rectal atresia in females. In males, high malformations include anorectal agenesis with rectoprostatic urethral fistula or anorectal agenesis without fistula and rectal atresia. So the answer For 13th question is answer C, anorectal agenesis with rectovaginal fistula. Question number 14. What priority action should the nurse carry out for an infant admitted with meningomyelocele? So you know that meningomyelocele is a birth defect of central nervous system, and it causes spinal cord and meninges stick out of the child's back due to incomplete fusion of bones of the spine. So when the spinal cord and the other meninges are uncovered, so you have to prevent the dehydration of this spine and the meninges. So you have to moisture it with normal saline resin to cover the sac. So answer is B, moisture with normal saline resin to cover the sac. Question number 15. What is the immediate post-operative care for an infant with cleft lip repair? So cleft lip often associated with abnormal nasal development. When cleft lip is repairing, so we have to repair the structures of the nose also. So because of the bleeding, the airway can be obstructed. So your priority immediate post-operative care should be assessing the airway for patency. So answer is B for the 15th question. Question number 16. What is the expected response occurs to baby during Moro reflex? So I think you know what is Moro reflex. Moro reflex is a reflex that develops between 28 to 32 weeks of gestation and disappears between 3 to 6 months of after birth. So it is a response to a sudden loss of support and involves spreading of the arms or adduction of the arms, pulling the arms of spreading of the arms we called as abduction of arm, and pulling the arms we called as adduction of the arms, and crying. So answer is answer A, symmetric abduction and extension of arms and legs with fanning of fingers. Question number 17. What is the signs of severe bronchiolitis among children? So this bronchiolitis or inflammation of the bronchioles, depending on the severity of the bronchiolitis, we can divide it into 3 levels as mild, moderate and severe. In mild bronchiolitis, the patient is pink in color and patient is alert. Heart rate is less than 140 beats per minute. Respiratory rate is less than 60 breaths per minute. Saturation is more than 92%, and no nasal pharynx grunting, and there will be mild subcostal recession, and the patient will be able to take more than half of the usual pills. But in a moderate to severe bronchiolitis, patient will be pale, cyanosed or gray, and patient's conscious level will be reduced. Patient will be fatigue and exhausted. Heart rate will be more than 140 beats per minute. Respiratory rate will be more than 60 breaths per minute, and saturation will be more than 93%, and There will be significant nasal flare in grunting, and there will be marked recession. The question is about the severe bronchiolitis. So answer A, hello, heart rate more than 140 and significant nasal flaring. Question number 18. Alif, a 5-year-old boy admitted to pediatric medical ward with fever and breathlessness. On examination, it was found that the inflammation affects his lungs in patches around the bronchi and bronchioles. What would be his diagnosis? You know that inflammation of the lungs means it's pneumonia. So pneumonia can be categorized into three types based on the area of lung affected. So one category will be lobar pneumonia. So in lobar pneumonia, all large segment of one or more pulmonary lobes are involved. In second category is bronchopneumonia. In bronchopneumonia, it affects the lung in patches around the bronchi and bronchioles. And third category is interstitial pneumonia, and it involves inflammation in interstitial pneumonia. Inflammation is more or less confined within the alveolar walls and peribronchial and interlobular tissues. So it asks about the inflammation affects in lungs in patches around the bronchi and bronchioles. So it is called bronchopneumonia. So answer is answer B. Question number 19. Which of the following is the significant symptoms of severe acute respiratory syndrome or symptoms of SARS? So fever, headache, dry cough, shortness of breath. So all these symptoms may be symptoms of SARS, but there are two significant symptoms. Those are dry cough and shortness of breath. So the best answer is answer A, high grade fever, headache, dry cough and shortness of breath. So the patient will not get chest pain, so we can omit answer B and D, and the patient will not be lethargic, and nasal flaring will not. Yes, nasal flaring, there will be nasal flaring. So the best answer is answer A, because the most significant symptoms of SARS include dry cough and shortness of breath. Then question number 20. Lim, a 5-year-old boy admitted with congenital heart disease. On examination, it was found there are murmurs, widened pulse pressure with bounding pulse. What type of heart condition that Lim is suffering? So if we take congenital heart diseases, congenital heart diseases include various types of diseases like atrial septal defects, ventricular septal defects, patent ductal arteriosus, atrioventricular canal defects, coarctation of the aorta, pulmonary stenosis, aortic stenosis, and so on. There are a lot of congenital heart disease conditions. So in when we see the answers in ventricular septal defect, ventricular septal defects are characterized by congestive heart failure and murmurs. So atrial septal defects are usually asymptomatic, sometimes may develop congestive heart failure and atrial dysrhythmias. In patent ductus arteriosus, it also is asymptomatic, but sometimes it may develop congenital congestive heart failure, machinery like murmurs, widened pulse pressure, bound in pulse, and bacterial endocarditis. In atrioventricular canal defect is characterized by moderate to severe congestive heart failure, murmurs, and mild cyanosis increase with crying. So the answer is answer C, patent ductus arteriosus. Okay, now I will stop here because we have no time to discuss all the questions. So if you have any doubt about the answers, you can please feel free to contact one of our academics in the department. Thank you.